Well, good afternoon, everybody. One more time, good afternoon. All right. That's the Akron I know. You may know I'm a native Akronite. I was born and raised in this town. And the fact that I am that native Akronite and the fact that I've had the privilege of serving as the CEO and president of Children's Hospital for the last 38 years makes today's gathering even more important. And I'd like to be able to share over the next several minutes a little bit about your Children's Hospital, a little bit about our community, the power of partnerships, the power of volunteerism, because it's very much an inspiring story for all of us. You probably all have heard the phrase that a society is measured by the way it treats its elderly and the way it treats its children. I know in my life journey, I've found that to be very true, and it's something I identify with. I also know in my life journey that my hometown, Akron, believes in its children. I also know through my life journey that Akron is a collaborative town. It has a wonderful spirit in terms of coming together and trying to do what we can to help those that need to be assisted. That does not mean that our job is done. In fact, we have a lot more to do. When I think about Akron Children's Hospital, I think about a wonderful story that I'd like to share a little bit with you, because today, your Children's Hospital is one of the world's greatest children's hospitals. We're in 90 locations. We have over 6,000 people that are in our workforce. Last year alone, we saw over 1 million outpatient visits. And some of the promises that were made to this community back in 1890 are still true today. So let me tell you a little story about the foundation that got built that we continue to build on today. And that's why I can tell you about all the wonderful things that go on in your Children's Hospital. I'm going to take you back to 1890. Ask you to put your imagination hat on a little bit. Here in town, there were two churches with two groups of women that used to get together on a regular basis and talk about the whole concept of service above self. And they were looking at things that they could do in the community that would be impactful. And they did notice that one thing was playing out in this community that wasn't good for kids. Parents were taking their children with them to work in the downtown factories. Now just think about what a downtown factory was like in 1890. And I'm sure you'll conclude as they did, that it surely wasn't a place to take your child. So they had an idea. Why don't we provide an option to those families? Let's have a nursery where the families can bring their child instead of taking their child to work with them. So they contacted a man in town by the name of Colonel George Todd Perkins. He had a home not too far from St. Bernard's Church that he wasn't living in. And he convinced him to donate the first floor of that home to them, and they opened a 2-room day nursery. One of the things they did when they opened the nursery, behind the reception desk in the main lobby of the house, they put 3 promises up on the wall. Promise number 1, every child that comes through these doors, we promise to treat as if that child's our own. Promise number 2 was we promise to treat you the way you'd like to be treated. And promise number 3 is we promise never to turn a child away for any reason. And back in 1890, that reason would have been race. They wanted to make sure that house was open to children regardless of the color of their skin. Today, there's a lot of pressure about finances of health care, and I can tell you we turn no child away because of inability to pay. Well, with those promises and with that caring spirit that they had, the community rallied around what was known as the Mary Day Nursery, and they were off and running. In the early operation of that nursery, a child was presented that needed medical care, not nursery care. So what did the volunteers do? They thought about promise number 1. Let's treat that child as if that child was our own. They talked to the family. That child needed medical care. They sought out a doctor. A doctor came to the Mary Day Nursery, provided care. The kid got better, and wow, when word of that spread back to the factories, you could bring your sick kid to the Mary Day Nursery. Guess what? They were overwhelmed with kids that needed medical care, not nursery care. Went back to Colonel Perkins and said, you have a 2nd floor in your house. Can we have that? He said, you can have the house. And they turned it into an infirmary for children, and they were off and running. From 1890 to 1925, They continued to invest, this community continued to invest in its children's hospital. And in 1925, Children's Hospital here in Akron was recognized as one of the 10 best children's hospitals in the United States of America. And we've continued to build on that. In 1927, polio came on the scene. And it was a scourge of the public health sector. And here in Akron, we started seeing a lot of polio cases. In 1947, the year I was born, actually, polio at Children's Hospital was such a demand on service that they were running an average daily census of 600 patients that had polio. And they didn't have enough beds for those patients. The church next door, the Grace United Church of Christ, a great partner, said, listen, we'll take the pews out of the main congregation area, and we can turn that into a large polio ward. And they did. Wonderful partnership. In 1952, very interestingly, there was a power outage that hit town. And Children's Hospital was hit with that power outage, and the church was hit with that power outage, where patients were in iron lungs being treated for polio. The staff scrambled. They all came together because there was no power going to those iron lungs. And they started to manually run those airbags. There weren't enough people at the hospital to do that, so they went out on the street, flagged down motorists who stopped their car, got out of their car, and came in and helped the staff. That's a community that cares about children, ladies and gentlemen. And it's another example of the power of partnerships. I could spend my whole time talking about the wonderful partnerships that your children's hospital enjoys. They obviously start with the parents that we're so privileged to serve, and then there's another 100 or so I could talk about. A few that I do want to mention, our partnerships with our Akron Public Schools are pretty special. We have a program where we have school nurses and school aides in 30 school districts throughout our region that we serve. And here in Akron, you probably saw, we just announced the Akron Children's Hospital Healthcare Academy at North High School. We're really looking forward to what we can do to mentor and connect with the children, but also the teachers and coaches in those schools that have a real influence on those children. It's going to be a great partnership. We're here in Goodyear Theater, and we have a wonderful partnership with Goodyear Tire and Rubber Company, whereby we're working on safety initiatives for our children relative to everything they face on a day-to-day basis. It's a very, very powerful collaborative. We have a collaborative with our city of Akron. Our mayor had the idea of setting up a health equity office in the mayor's office. Needed funding, needed people, needed support. We're part of that, and we're very, very proud of that. I look at what's playing out with the whole issue of opiates. I look at what's playing out with babies that are still being born with addiction because of their parents. And we're partnering with a number of agencies to try to make sure we can move that to the sideline, get past that, the way we got past polio. Polio is not an issue we deal with today because of the way the communities came together. Partnerships. Partnerships are so important to us. Key to those partnerships, ladies and gentlemen, is the fact that your children's hospital has been built on a base started by those volunteers in 1890. An independent entity that is focused and cares solely on children. And your children's hospital is an independent entity that's community governed. We're much more than a hospital. We're an integrated pediatric healthcare delivery system that now is the largest pediatric provider in Northern Ohio, and as I already said, recognized around the world for what we're able to do because of a caring community. But our work is not done. When I was thinking about what I might share with you today, I came across a report that was commissioned in 1989. In 1989, I had the privilege of serving as the chairman of the National Association of Children's Hospitals. And during that tenure, we commissioned a report to look at the status of child health in our country, our wonderful country. That report was sobering. It pointed out that more and more of our children weren't being immunized to things like polio. The immunization rates were going in the wrong direction. That report showed that more and more of our children are going into poverty. More and more of our children are homeless. More and more of our children were not able to access insurance. Many of those children had parents that had insurance, but they didn't have dependent coverage. It showed that as a country, believe it or not, we were doing a better job exploiting our children than nurturing our children. So we talked to our folks, our elected officials at congressional briefings. We had a major press announcement at the National Press Club. I appeared on the Today Show and challenged our elected officials, challenged people in the communities to advance social programs, public policy that were focused on children. I stand here before you today and say that almost 30 years later, we've not done a very good job. We truly haven't. Akron as a community could be an example for other communities and is an example for other communities because of that spirit of collaboration. But when I look at some of the conversation that's going on right now in our nation's capital about what's playing out with health care coverage, it causes you pause when you know that the #1 program that funds child health care in this country, Medicaid, and they're talking about reforming or repealing or replacing the American Health Care Act, the Affordable Health Care Act, that has Medicaid as its core. They never mention the word children. Here in Ohio, we have 2.4 million children. 1.2 million of those children are on Medicaid. Nationally, we have 30 million of our children on Medicaid. No program covers more children than Medicaid. Yet, our elected officials are talking through the American Health Care Act of taking about $840 billion out of Medicaid over the next 10 years. Yet can't tell me, and even more importantly, can't tell the parents of special need children how that's going to affect those kids. We as a community, we as adults, we as voices cannot let that happen, and we won't let that happen. Our children are just too important to all of us. We know that. We know that. So how can we have a debate? So how can we have a debate about health care, which needs to be held, and not mention the word children? We can do that and advocate. That's what our voices are used for. I'm not saying the Affordable Care Act shouldn't be amended. There's a lot of change that needs to be done in that. Medicare, when it was first enacted in 1965, had about 283 amendments in the first 4 years. The Affordable Care Act, because of the partisan nature of our elected officials right now, has had none. But the answer is, let's not cast our children away as we're having that debate, and we just won't let it happen. So I'm optimistic. I know we're going to be able to continue to advance what we need to do for our children. I thank you for being here today and listening to the message. I want to close by sharing with you this morning when I was on the treadmill going very slow, listening to Lion King, which was one of my favorites. There was a phrase in there that I'll close with. From the day we arrive on this planet and blinking step into the sun, there's more to be seen than can ever be seen. There's more to do than can ever be done. Some say eat or be eaten. Others say live or let live. But all are agreed that join the stampede, you should never take more than you give. It's called the circle of life, folks. And key to that is what we do and how we invest in our children. Let's make sure we're there for them. God bless you.